This is Dr. Corey Maas on Looking Your Best. Another a series of questions came in with followers and patients about minoxidil, which has hit a recent news cycle. And specifically about side effects related to the use of this otherwise blood pressure medication. It's important to keep in mind that people that are using minoxidil for hair growth are typically using very small doses, 1.2 to 2.5 milligrams daily. And in blood pressure medicine, it might be used at 5, 10, 20, even 40 milligrams per day. So those much higher doses do have side effects which could be beneficial in men with body and facial hair growth and thickening the mustache and beard area. On women, those may be unwanted side effects, and that's a serious concern. There are a couple things that are clear that are beneficial, including the absence of certain side effects. In large-scale studies, there's not been much difference shown in Propecia, which is also finasteride, the trade name, which probably the most commonly prescribed oral medication for men's hair loss, which blocks the conversion of testosterone to 5-DHT, which is the culprit in men's hair loss. That's a genetic type of hair loss. In a handful of men, and it's not really been sorted out why or if it's even real, there have been cases of decreased libido. There's no really decrease in fertility or anything, but those cases are still not being sorted out whether it's sort of a effect of the suggestion that it could cause it, or those small difference in the number of cases that were seen in the studies for that drug. Now, we're not talking about minoxidil. Now we're talking about finasteride, but it is a difference in side effects in that minoxidil does not cause or have any effect on testosterone levels or 5-DHT levels. And therefore, it is not, and nor does it have any effect on estrogen levels. So all of those would lead one who wants some hair growth or hair improvement to lean a little bit toward minoxidil if you were choosing between using Propecia, finasteride, or minoxidil. There's no evidence right now that they both can't be used, but for people that are looking to avoid the potential, although infinitesimally small, side effect of decreased libido that is seen in some men taking the Propecia medication, the finasteride, to try minoxidil low dose instead. Again, it's a blood pressure medicine. It does cause some increased dilation of the blood vessels, but its actual mechanism goes beyond that, and it actually helps to lengthen the growth cycle of hair and decrease shedding. If you have other questions on minoxidil, hair growth, medications for it, or hair transplant for that matter, please don't hesitate to write us at drmaas.com. As always, it's my pleasure to help you stay looking your best.